Why health advice sounds simple but rarely feels simple. You may have heard this many times before. Eat well, stay active, get enough rest. It sounds clear, it sounds reasonable. And yet, for many people, especially later in life, it rarely feels that simple. If health advice were truly as straightforward as it often sounds, fewer people would feel confused by it. But confusion is common. Not because people are careless, but because much of what we hear about health is shortened, repeated, and stripped of its context. Over the years, health messages have been designed to be easy to remember. Short phrases travel well. They fit into headlines, posters, and short television segments. But in becoming simple, they often lose something important. Explanation. When someone hears "eat well," it sounds like a complete idea, but it quietly assumes many things. It assumes shared definitions, shared circumstances, shared bodies, and shared access. None of these are actually shared in real life. For someone in their 50 seconds, 60 seconds, or 70 seconds, the body is not the same as it once was. Energy changes, tolerance changes. Habits formed over decades do not disappear simply because a sentence is repeated often enough. Yet health advice is rarely spoken with time in mind. It is presented as if it applies equally, effortlessly, to everyone at every stage. Another reason health advice feels difficult is that it often arrives without its original background. Many health messages begin as research questions, not instructions. They are shaped by studies, averages, and controlled conditions. But by the time those ideas reach the public, much of that background has been removed. What remains is a conclusion without the conversation that led to it. This can create the impression that health information is constantly changing. One year something is praised, another year it is questioned. From the outside, this can feel frustrating or even exhausting. But often, what is changing is not the idea itself, but the way it is summarized and shared. Health communication favors clarity, but clarity sometimes comes at the cost of completeness. There is also the issue of repetition. Hearing the same advice over and over can make it feel less meaningful. When a message is repeated without new context, it can begin to sound empty, even if it was once carefully considered. Over time, people may start to feel that they are missing something everyone else understands. In reality, what is missing is often the explanation, not the listener's ability to understand. Another quiet challenge is that health advice is usually spoken as if it exists outside of daily life. But real lives include work, family, culture, memory, routine, and limitation. Health messages rarely acknowledge these factors, even though they shape how information is received and understood. This gap between advice and lived experience is where discomfort often appears. Not because the message is wrong, but because it is incomplete. Understanding this can change how health information is heard. Instead of asking, "Why is this so hard to follow?" it may be more helpful to recognize how much has been left unsaid. Simple health advice is not meant to be misleading, it is meant to be accessible. But accessibility does not always mean adequacy. As we hear health messages today, it may help to remember that they are summaries, not full stories. They are starting points, not conclusions. And they are shaped by the need to be brief, not by the complexity of real human lives. Health understanding is not about memorizing phrases. It is about recognizing context, limits, and perspective, and that understanding often comes not from doing more, but from seeing more clearly. This content is for general educational purposes only and does not provide medical advice, diagnosis, or treatment. Health topics discussed are informational in nature. For personal health concerns, please consult a qualified healthcare professional.